Yes, now I can hear you very clearly.
Ji, ठीक है. Okay, well, we'd like to welcome you, and on behalf of Association of Pakistani Physicians and Surgeons, I also would like to thank you and welcome all the participants which are joining from across the world, and especially from the United Kingdom. Just a few words about the Association of Pakistani Physicians and Surgeons. We are the longest and the largest medical organization in the United Kingdom. And Alhamdulillah, we have been blessed to do many, many things for Pakistan, from giving our professional time, teaching training, and recently in these special circumstances, we are providing training and guidance over our webinars on every Sunday. Alhamdulillah, we also have our own YouTube channel where our activities can be seen across the world. I would like my leadership of APS UK, who's present here, to introduce themselves, starting from our very respected chair, Dr. Shahina Anjum. She's our present chair. And can you please introduce yourself, Dr. Shahina?
जी, अस्सलाम वालेकुम जी. मेरा नाम Dr. Shahina Anjum है. I'm graduate of Fatma Jinnah Medical College, Lahore, and I'm currently working as consultant pediatrician in UK. I belong to KPK, so a lot of the projects that I am involved with are mainly based in KPK at the moment. Thank you.
Thank you, Dr. Shahina. We have our very respected vice chair, Dr. Shahid Sharif Bhai, who has been quite vocal and outstanding in initiating this overseas Pakistani medical diaspora with the Health Ministry of Pakistan. Doctor, would you please kindly introduce yourself?
Assalamu alaikum. I am Dr. Shahid Sharif, and I welcome Dr. Zafar Mirza and Dr. Shahid Rafiq and all the other participants. It is my pleasure, and I am excited that today we are launching the Pakistan Diaspora Initiative, or Yaran Watan, in UK. So please welcome.
Thank you, Dr. Shahid Sharif. A very important person who actually started all this projects of APS UK, the man who had the dream, like I always call him our Allama Iqbal, Dr. Abdul Hafiz Bhai. Would you like to please, as the CEO of the organization, would you kindly please introduce yourself? And do you also mind saying a few words about our recent activities for the viewers across the world? Thank you.
Assalamu alaikum, everyone. It's a great pleasure to be sitting here with our Federal Minister Sahib, as well as other respected colleagues from APNA and organizations as well. Association of Pakistani Physicians and Surgeons obviously has a long history in terms of our contributions, in terms of what we have been doing for Pakistan, as well as Pakistani community, medical community in the UK. With regard to COVID, there has been a number of activities where association have actually stepped up and obviously providing a lot of services to Pakistan. The first thing which we did was to collected funds from UK, and we have sent PPE kits. I think there were about 1,700 kits which have gone from different organizations from UK. APS UK contributed for 500 of them, and some of them have actually gone, or some are still on the way. This was the initial need which we felt we need to obviously step up. The second one was the training for doctors, because we realized there are a number of institutions which have the ventilators, but doctors have contacted us that we can't use them. So through these webinars, our Dr. Taimur Mirza, who is our ex-president, has been regularly providing live training sessions. And then the recordings are available. We've been answering questions. People not only from Pakistan, but also 27 different countries in the world. Doctors have been joining APS UK webinars because the needs are the same. People wanted to know how APS UK or how UK health system is managing these COVID cases. And obviously this has been a huge need, and we are working on that front. In addition, we are providing telemedicine clinic, which Dr. Sohail Chugtai is actually leading. So I will leave that to him to explain more.
Thank you very much, Dr. Abdul Hafiz. As you mentioned, our Dr. Sohail Chugtai bhai, with regards to telemedicine, he's taken the lead, and I noticed many people are following his dreams of providing this very valuable service, keeping the risk of the disease to be spread. Dr. Sohail Chugtai bhai, could you please introduce yourself and say a few words? Thank you.
Assalamu alaikum, everybody. Assalamu alaikum, Mr. Saab. I really appreciate your presence today. I'm Sohail Chugtai. I'm an orthopedic surgeon based in London. At the same time, my second activity, equally taking my time, is being a Microsoft certified expert and also a master's in telemedicine. I've been designing telemedicine websites for the last 10, 15 years almost now. One of them has been serving Pakistan as the hotline for telemedicine. And I think you've been sent the papers. We've had about 26,000 teleconsultations in the last 4 weeks. And the Governor Saab inaugurated that. I gave a briefing to the President on the 4th of April in Lahore. And he appreciated the work done. We tried to contain the disease by keeping people at home. We thought they should not flock the hospitals. And so we are doing that work, and inshallah we'll do more. This morning only we trained 60 more doctors who will be inducted into the system from APPS UK to help Pakistan. And I've been recently awarded as the only professor of telehealth in Pakistan on account of the services to the country for the last 10 years. Thank you.
MashaAllah, as you can see, Zafar Mirza, as being a medical professional yourself, that we have a variety of expertise, and APPS UK is working whichever opportunity is required to work in every level, from ground level to the highest professional level in Pakistan. Can I please request Dr. Shahid Sharif Bhai, who's representing APNA from USA. Unfortunately, Dr. Nahid Usmani was unable to join us due to her last-minute clinical requirements and changes at work. Dr. Shahid Sharif has been very kind enough to join us, and he will please introduce himself now.
Shahid Rafiq.
Shahid Rafiq, sir.
Ji, Assalamu alaikum, Shahid Rafiq. Thank you, Minister Zafar Mirza. It's nice meeting you again, this time virtually. We had great meetings in March when we APNA held the conference for family practice in Pakistan, and UK alumni contributions to Pakistan. We knew them, and today we see them also are really impressive. And that is why we welcome your initiative, Yaran Watan, where you have tried to connect. We also tried on our level, UK and US at various times to do the joint, projects. But again, the time difference sometimes, like this event management course I had discussed with Dr. Abdul Hafiz that we are starting, and the time difference was such that and the webinar, and he was very kind to attend those webinars. So as you know, Dr. Mirza, and for the other participant who may not know, that for the current COVID, APNA has also collected a significant amount of funds, close to 600,000, and the target is 1 million. And as they are collecting the funds, and recently they had a telethon, and in 2 hours they collected over $225,000. They are sending this to Pakistan. Most of it is going to Pakistan, I think 80%, and most of it in PPEs and masks, but some in foods and donations. So that was Nahid's part, which she could have told better, but she's on call. But I represent a committee of APNA, which is called APNA Merit, and that is what we are talking about today. Basically, what we can do for Pakistan, mostly in terms of medical education, healthcare, and how can we help our colleagues for capacity building. And so towards that, for the COVID, we started on 31st of March, a daily webinar which ran without any interruption consecutively every night, 11 p.m. Eastern Standard Time, which was 8 a.m. in Pakistan. And mashallah, large number of physicians from Karachi to Peshawar were able to join that and learn from the ID specialist, pulmonologist, intensivist from USA. And Dr. Hafiz had attended many of them and contributed his perspective from UK. And with the Ramadan, of course, the timings have been changed. Now we are doing, today we did our 4th in Ramadan. We are only doing Saturday and Sunday, and it's 8 a.m. in Eastern Standard Time, New York time. And in Pakistan, it's 5 p.m. Then vent management course, we combined the cohort of intensivists here, but then we found that there is a group of intensivists in Pakistan from Karachi and Lahore and Islamabad, who I think Dr. Zafar Mirza already know, are training the non-intensivist with a intensive ICU course for the non-intensivist, which runs for 10 days, and it is based off Chinese university in Hong Kong. I think its name is BASE. So we had 2 meetings with that group already because we didn't want to duplicate the effort. So what we decided that once they are training, they have already trained 200 people and their target is 1,000. So once they train those cohort, we will take them and do mentoring for those people. So these are the efforts that we have done. Thank you.
Can I please, sorry to interrupt, Dr. Rafiq. That was very eloquent, and I'm sure you will be rewarded. Our focus is on the launch of Yaran Watan in UK today, and we are very thankful for your very eloquent introduction. Can I please go now to start the presentation? Can I ask Dr. Usman please to introduce himself first? Dr. Usman has been very kind enough and has joined us from Oslo in Norway at the moment. And he is going to do a co-presentation with our very respected Minister Saab from Pakistan. Can Dr. Usman please introduce yourself first, and then we will pass on to our chief guest. Thank you.
Thank you so much. Thank you so much. Assalamu alaikum, everyone. It's great that we get the opportunity to speak about all the exciting work that our diaspora health professionals are doing in Pakistan. I'll just quickly say that the presentation today will be a twofold presentation. So Dr. Zafar Saab will be talking about the overall context of how Yaran Watan developed and the support that we got from the overseas community in doing so as a true collaborative platform, and then I'll go through the platform. I work with Dr. Zafar in Ministry of Health, and particularly in Yaran Watan, I decided to move from actually Norway to Pakistan in order to help build this initiative with great support from APS and UPNA and other diaspora organizations. Thank you so much.
Thank you very much. Dr. Saab, I'm referring to Dr. Zafar Mirza Saab now. May we please request you to bless us with your presentation. We are waiting for it desperately. And I must tell you, there are hundreds of people across the world who are watching this right now. And especially, I have a very long list of professionals, medical professionals, especially from UK. So over to you, sir. Thank you.
Just to mention one thing, we are live on Facebook. So I think there's a huge crowd which is watching us there. So you can share, please, if you can.
Okay. All right. Bismillah ar-Rahman ar-Rahim. Thank you very much, Dr. Shakeel Puri and all the other colleagues, friends. I will avoid taking names of everybody because that will eat up a lot of time, but all of you are very valuable, and thank you very much for your continuous support and interest in your homeland. Well, let me first say a couple of things before I speak about Pakistan Diaspora Health Initiative. First of all, you know that in Pakistan, we have been working right from the beginning, since particularly mid-January, and it has been a marathon. And actually, there is no end to it in view at the moment. So, what I want to assure you is that your government here is working very hard to the best of its resources, understanding, and effort. So we are trying to protect as much as the people of Pakistan from this coronavirus disease. I'll spare you with the details what we have done. covid.gov.pk sums it up for us. It has all the important, apart from updated information, official statistics. It also gives you a lot of information about the government effort and what we have been doing. And when I say what we have been doing, I mean federal government and all provincial governments and GB and AJK. I mean, this has been a tremendous experience also for all of us, that how country can come together to address a problem of this scale. Secondly, I also wanted to say that Alhamdulillah, all the predictions and all the worst case scenarios that we had or others had predicted about Pakistan, until now, even our own predictions, we are below those predictions. And especially when we compare the situation in Pakistan with other countries, especially in Europe and US, where most of you are situated, Alhamdulillah, the situation in Pakistan is much better. You might be listening to different press conferences that I've been doing, Asad Umar Saab is doing. We try to be as clear and transparent with people as much as we can. To be honest with you, since 13th of March, there is hardly a day that we have not gone live on television every day, explaining to the people of Pakistan that what the situation is in last 24 hours and what are the trends and where we are heading towards. It has been a roller coaster, but having said this, we are very cognizant that we have not peaked. We don't know when the peak is. There are speculations, there are predictions, but we don't know. The bottom line here for us is that given the natural history of this disease, knowing very well that 80 to 85% people only suffer mild and moderate symptoms, we are concerned about that 4.8%, which is a global average, which go into critical care, which fortunately also until now for Pakistan has been 2.5%. So our bottom line is that our health system does not get overwhelmed with the critical care patients. The rest of it is like any other disease that we'll gradually learn to live with. So we are very conscious about it, and we have tried to put our house in order in terms of continuously trying to assess our needs according to a very, very rigorously developed system. So we can, to the last digit, can tell you that for the next 30 days, at any given point, what would be our assessed needs, which are guided by, number one, the predictions that are available with us, And those predictions, at least 4 different groups, I've been able to bring them to the table, who were doing differently, not differently necessarily, but in silos. They were all churning out different numbers. So I have brought them together, and we're trying still that they agree on one predicted number for next 30 days, or at least give us a agreed range. And that is our guidance to assess our needs for next 30 days. Why I say next 30 days, because the quality of data that we have, as well as the limitations of the prediction work, does not allow to predict as reliably beyond 30 days at the moment, in Pakistan at least. So that's one guidance that we get from predicted number. And the other one is our own guidelines for use of, rational use of different PPEs or needs for ventilators or other equipments, etc. So every week on Monday, we assess our needs according to these 2 things. That is predicted numbers and our guidelines, and we assess our needs for each item, and then we give it to our lead operational agency, which is National Disaster Management Authority, which then actually help us to tell us that what is in stock and what is in the pipeline. And then we just see that what are the gaps, and then those gaps are our targets. So just wanted to give you a sense that how the government is looking at all these things. As all of you know, that we have established a National Command and Operations Center, which is a kind of melting pot for all federal ministries, relevant ministries, all provincial governments, government of AJK and GB, and all relevant organizations. We bring them at around one table, whoever, and it has been a tremendous experience there. And as you know that this NCOC is still an operational arm of NCC, which is National Coordination Committee, and National Coordination Committee is chaired by the Prime Minister himself, and the Prime Minister convenes at least 3 meetings in chair, small or medium level meetings, some internal, some wider, in which we brief him, and so it's the highest possible level. Our President is very much involved, our Chief of Army is very much involved, and this NCOC is a joint effort of civil military initiative. Just wanted to give you a sense that what is the level of involvement and rigorous effort that we are undertaking here. Now, coming to the situation with reference to different, we have tried to mobilize so many different initiatives. One of which was my, sort of dream for some time, even before becoming minister, when I was working in health systems, I always thought that developing countries are not systematically engaging and benefiting from their own ones who are now serving the health systems in especially high-income countries. And I always believed that it is the responsibility of the governments to provide a platform and a framework for channelizing their contributions back home. Because having lived myself abroad for more than 15 years, I understand that how much all of us, when we are outside, want to support our people in the country. And our exposure to well-developed health systems help us, and actually also irritates us that why we could not do these things in Pakistan. So, and also the chronic, the health workforce shortages this can also be a way to address those. So, Pakistan Diaspora Health Initiative was that kind of dream that I always wanted to build. We had been working on it for some time. and we were trying to, develop it with a view that how we can actually harness the potentials, contributions of various kinds by colleagues in outside countries. But then came COVID-19, and we decided that it's COVID-19 version we should immediately launch, and that's what we have done. And thank you very much, all of you, for supporting it. I always say that this initiative is not just Government of Pakistan initiative, it's a partnership, and it's a partnership here. It's a partnership between Ministry of Health and Ministry of Overseas Pakistanis and Human Resource Development. And also it is a partnership between us as government with all of you and your associations. And some of you were present, I think, in last August it was, when we met in Islamabad, and APNA and APPS were represented there. And we spent a whole day in discussing and, trying to visualize and shape Pakistan Health Diaspora Initiative, which then eventually we started talking, started titling it as Yaran Watan. The name is beautiful. I love it. And whoever actually listens to it has, it does something when we say Yaran Watan. And some people say that the name is too big. We have to now see that what it delivers. And I take that, and we'll come back to that. So this is how it is. The mission basically is to realize the full potential of the diaspora community for health sector development in Pakistan. And let me also say here that this is in no way to indicate that if this or any this kind of platform would not be there, diaspora would not be working. You have been working for decades for Pakistan through different initiatives, projects, and you have made tremendous contributions. This is not to undermine in any way, not to complicate in any way, and not to say that anything else is not possible beyond this platform. But this platform is an effort to bring some method to the madness, as we say, or bring some, here I say madness in a positive sense. And, to bring a framework whereby diaspora groups, individuals, institutions can register in and offer what they can offer depending upon their comparative strengths and interests. And the government sits in between the contributions and the identified needs in the country, and try to do matchmaking between what is offered and what are the needs, and try to connect them. Again, not to say that you don't know the needs. You might be knowing better than us, maybe some of you especially who have been working for years and decades in Pakistan. But this is like a humble government effort to bring some kind of, framework to the whole work which you continue to do. And the success and the future of this will depend that how much all of you try to use it in a way that it makes sense, and it establishes its usefulness to you, and also over a period of time build trust that what you want to do, if you find this more helpful, only then you will use it. We are very clear about it. And hence, the challenge that we have set for ourselves is that how much we can facilitate, and how much we can be efficient, and how much we can actually meet your expectations in terms of channelizing uh, what you want to do. Now, the numbers are staggering. There are more than 30,000 doctors of Pakistani descent in different parts of the world. And these are first generation doctors, their own children who have done medicine and who are not part of the system in Pakistan. They are not counted for in it. So the numbers are huge. And I think that this, if we can systematically benefit for the health sector development in Pakistan, this would be it. This can be a tremendous initiative. You would agree that not all health professionals in outside countries are even part of your associations. Some of them silently, quietly continue to contribute. Some of them are more visible than others. And some of them always wanted to do something, but never knew how to do it, kind of situations. So all this means that here we create a platform where um, with confidence and with some degree of trust, the government, the health professionals can engage back home. Now, the other thing which I want to say is that when I mentioned this to Prime Minister Saab recently, as you know, that he really believes in the asset that we have in the form of our overseas Pakistanis. And he was very glad. I saw a big smile on his face when I told him that this is what we are going to do. And he really liked it, and he's very supportive of this. Now, coming back to more, specifically with reference to COVID-19 and the version that we have launched with reference to Yaran Watan for COVID. Some of the things that I've heard today, for what you are already doing, they are very, very useful and very much needed. And I think that if we can use even for these efforts which are ongoing through Yaran and Watan, this will become more win-win kind of situation, because we want to reach out to as many doctors and health professionals here, and the hospitals and the health facilities here through different innovative ways. We have ourselves learned over a period of time, over the last couple of weeks, that how we can actually deliver, for example, the personal protection equipment to hospitals. Now we have a list of hospitals. In total, about 400, but 220 around about hospitals are in Pakistan, which have ICUs, which are of quality, and where our frontline workers will be dealing COVID patients in critical conditions. And they are the first priority in terms of trainings and availability of PPEs. So we are now through NDMA, National Disaster Management Authority, we are directly delivering these to those hospitals. But what we are also realizing is that we are not seeing appropriate use of them. So irrational use of personal protection equipment seems to be a big challenge right now. And I'm very glad that some of you are telling that you have been conducting webinars and training doctors, which is great. We, as federal government, we have also started a training program, which Shahid Rafiq sir was mentioning. 5,000 health professionals, out of which 1,000 doctors and 4,000 nurses and paramedics will be trained over a period of about 6 weeks. Registrations are going on. And I think you can be a great resource there to team up with the team of trainers here and develop a sort of an aligned approach so that one, that we cover as many hospitals as possible, and two, we don't duplicate in same hospitals, same trainings. So that's one of those advantages of having a central coordination system in place. Secondly, obviously, in public sector hospitals, there are a lot of problems. OPDs are closed. So I think through COVID-19, the time for telehealth has come to Pakistan in a major way. As Suhail Chugtai sir was mentioning, telehealth is, there are major initiatives which are going on at the moment. I know about this initiative that he was talking about in Lahore. We are partnering, Yaran Watan is partnering also with Digital Pakistan, and we are also launching a platform where whereby people can, first of all, can be verified as doctors, and then they can be linked with different requests that we receive. And this platform will be linked with many other such initiatives which are going on at the moment. And we have also agreed with the Digital Pakistan that doctors from abroad who are interested to provide their advice through telehealth can be linked through Yaran Watan with this telehealth platform, through which they can, and Usman will talk more about it. So I personally feel that, and I know that there were a few hiccups in the beginning in terms of registration with, on this platform, but all those have been removed. Well, lastly, let me also say, and Usman will provide you more technical details. Let me also make a concluding remark by saying that in all this, huge emergency, global pandemic, so many deaths, so many cases, future uncertain. But I always say that in the recorded human history of us as human beings, health of human being has not received as much attention as it has received in the last 3 months. Everybody seems to have become an epidemiologist, and everybody's talking about the importance of prevention and public health and the need for the capacity of the health systems and health care system. And I think there is a huge opportunity brewing up in the midst of this challenge, that how we leverage this political attention and the financial attention which exists right now for the health sector, not just in Pakistan, all over the world, and especially in developing countries. How we leverage this and do not let this momentum go down in terms of continuing to highlight and continue to contribute the needs of the future healthcare system in Pakistan. I'm talking about Pakistan here. And I think we should start visualizing that how the post-COVID-19 world would look like in Pakistan as far as the healthcare system is concerned. And our Prime Minister is actually pushing us, all of us, for this. He is asking us to develop think tanks in each ministries, that how this this crisis can be turned into a long-term vision for reform. all kinds of reforms, but of course the central reforms need to be taken place in health sector. And there again, I would very much like all of you who are our brothers and sisters outside Pakistan to be part of that nation building as far as the healthcare system of the future is concerned, that part of nation building. Because I think that everybody now understands that the notion and the construct of the health national security has changed forever in developing countries, and there will be no concept of national security without health security. And the infrastructure for health security, which rests on the healthcare system itself, unless we invest in it, we can continue to be falling in this kind of crisis, because who knows what future holds for us as far as the spread of disease is concerned in the context of increased travel and trade in globalized world that is happening. So I'll end here. Usman can take you further with the presentation, which will be more technical. And I would, once he starts his presentation, in the midway, I will quietly slip away also because I have another commitment. But it's really lovely to speak with you, and it is very inspiring what you have already done. Yaran Watan is your platform. Its success or failure will depend on you. If you think that something like this is worth investing in sense of effort and use, please do that. At least give it a chance once. And if you think that it is worth continuing with it, that would be great. Usman and the team has worked very, very, very hard on this, and they have really given their days and nights to it. If it proves its worth in COVID-19 context, then as COVID-19 goes down, it can be expanded and established as an ongoing platform, which, as I said earlier, and I will not repeat, the future of healthcare and its building can also take place as far as your contributions are concerned through this platform. Thank you very much.
Thank you very much, Dr. Mirza. I'm, as the president of Association of Pakistani Physicians and Surgeons, I would like to give you the assurity that all the members, and I'm sure Dr. Shahid Rafiq from America can also assure you that all our members, we are all ready to provide our services for Pakistan at any level. And I'm also very thankful personally for you to share this Yaran Watan initiative document with me personally in the beginning of February in your office. So thank you very much for doing such an impressive job. And it must be very hard to go on media every single day and explain what government of Pakistan is doing to make sure.
Tell me about it.
Yes, we are very thankful that the government has made the right decision to put the right people for the right jobs, especially you coming from an enormous experience of World Health Organization and being a medical professional, and also that you have the experience of working abroad and in Pakistan, and you also have studied in Pakistan. So thank you very much for that. One quick request I would like to make, that love is a two-way street. I think now that the fact that you are recognizing that the medical professionals are able and willing to provide so much for Pakistan, to develop the medical treatment systems and the health systems, may I suggest and propose perhaps to get our respected members on some sort of think tank and perhaps parliamentary committees, and so they can propose and what they've learned abroad in the rest of the world, to take all these polished abilities to Pakistan and bring Pakistan at a different level. So would you please kindly consider that, and perhaps you can pass our message to the Prime Minister and also our President of Pakistan, who is also come from a allied healthcare profession. Thank you very much for your time. We do have quite a few questions from people who participated. Would you like to stay for a little while now and answer, or would you perhaps want to do that after the presentation is completed? I don't know your schedule.
If Usman is cooperative and he can quickly finish his presentation,
Yes.
then I can stay for a short while for taking questions.
That's very kind of you. Over to you, Usman bhai. Thank you.
Thank you so much, and thank you so much, Dr. Zafar Saab, for that great introduction to the vision that you outlined and the opportunity to actually contribute to that. And I just from the outset would like to say that this has been a tremendous collaborative effort from the get-go, from when we started back in actually May. And it's not only the medical fraternity that has been heavily involved from the diaspora side, but also other health professionals. And also people that are not within the health profession. So it's been great to be able to work in this great partnership. So since we launched, I would just quickly let you know that we have had a fantastic response. More than 1,800 people have signed on, albeit we experienced some technical difficulties initially. Most of these are now solved, and from the Pakistani side. So basically the concept that we launched initially for COVID-19 is that this is a facilitation mechanism between healthcare professionals living abroad that wants to voluntarily contribute to Pakistan. And obviously, given that the flight operations are not possible, so these clinical and non-clinical contribution will be taking place digitally. So from the Pakistani side, we had already onboarded 10 health institutions that was verified by us that would be providing free of cost care to patients in Pakistan. But since the launch, we have received almost 100 health institutions that wants to tap into the great reservoir of knowledge and expertise that we have in the diaspora community. So it's great with this tremendous response initially. I would just quickly go through how the portal works. I know that the medical fraternity is not always the most tech-savvy one. So very briefly, the platform is made to be as simple as possible. So whenever you come to the front page, it'll take you either direct towards explaining what it is, or that you'll be able to register. So when you register, you'll obviously register as a health professional. You fill in your details, and you'll be taken to the dashboard. On the dashboard, you'll see two things. One of the things that I think will please quite a lot of you is on the PMDC license status. So one of the major things that we realized is a lot of overseas healthcare professionals, what they struggle with when they want to go back and contribute to Pakistan is their PMDC licenses. So basically what we did was we are building an integrative system with the PMDC system so that whomever that wants to come and volunteer in Pakistan could, through Yaran Watan, apply for a volunteer license, or could renew their PMDC license very easy and very swiftly. I have to say that this module of the platform is not activated yet. As you probably know, there has been multiple issues with PMDC. But whenever we start with clinical and non-clinical missions, and when flight operations open up, this would become more prominent. So in your dashboard, you have a quick snapshot of your profile and the volunteering opportunities that you've applied for. It's very important that people, when they sign up, actually complete their both personal and professional information. The professional information also gives us a database that we will over time build, and which can be quite beneficial for the government whenever in time of crisis and we want to tap into our diaspora community. After you've created your profile, you can go directly to the opportunities page. And opportunities page is basically the volunteer listings that the onboarded health institutions have created. Here you'll find both private organizations and companies, and governmental initiatives and organizations. Now, obviously, all the onboarded private institutions and and organizations have, prior to onboarding the platform, agreed that whatever resources and whatever volunteer work that they're receiving from the overseas community is provided as free of cost. So most of these telemedicine companies that we have onboarded have agreed to that, and they're been quite helpful to the government's efforts in providing or launching telehealth across Pakistan. There are also government initiatives that we're recruiting overseas health professionals for. One of the things that Dr. Zafar mentioned was the Digital Pakistan and the Ministry of Health platform on telehealth, which will be operationalized in a very short amount of time. Another thing is the Health Services Academy looking for public health professionals. So this is, just to point that out very clearly, we're not exclusively looking for medical doctors, we're looking for all type of healthcare professionals. And with time, the volunteering opportunities will increase in diversity and will cater for a lot more professions and a lot more of skills. So basically the platform, and this is also an important information, the platform does work as a matchmaking, does serve as a matchmaking function. We do not take any direct responsibility for the interaction itself, rather than providing a quality control over it. So when you're already onboarded and you want to offer your service to a certain organization or a company, we will make sure that it's quality controlled, but the actual interaction happens between the organization in Pakistan and the overseas health professionals. So this is the novelty in this, where we try to be the broker and the matchmaker and not take over the full process, which would obviously be much more tedious. It's also possible for people, overseas health professionals, if they cannot find anything that is suited for them, to list their own availability. Obviously, this is much more relevant in when the clinical and non-clinical mission starts in Pakistan, where you'll be able to tell the timing of the period that you're in Pakistan, that you're available, that health institutions can contact you on. Very briefly, there is also we have also built in technical support. So the team have been doing tremendous work in replying to all the technical queries. So feel free to reach out to us at any time. And as I mentioned, it's quite important that the actual contact after having been selected a volunteering opportunity and being accepted happens off the Yaran Watan platform. With time, the Yaran Watan platform will increase in complexity, and most of these interactions maybe we can cater for on platform. But in order to keep it simple, this is how we've chosen to do at this moment. That's the brief, short run through it. We have great educational videos that is up on our YouTube channel, and I would advise everyone to follow our social media pages, which are regularly updated with the latest information, and which provides you quite good insights into how Yaran Watan is developing. Thank you so much.
Thank you very much, Dr. Usman. Let me just go back.
Thank
to the... Sorry, Dr. Zafar Mirza Sahab, you wanted to make a comment there?
No. I just wanted to thank Usman to very quickly finish. And now we can have maybe a few questions and comments.
Yes, can I just first of all thank you, both of you, for doing this very eloquent presentation. Please do take this message back to the government that there's always going to be a warm handshake from the medical professionals abroad. And please do also mention that if it's possible, that we are taken into account when you make some future decision making. It'll be useful. I have Dr. Abdul Hafiz. He has a couple of comments to make, and then we start a very brief question and answer session. Dr. Abdul Hafiz, would you like to please carry on now?
Thank you very much. I will not take too much time. Will be very fast in my few points I would like to make. This pandemic, which is going on at the moment, is actually a very steep learning curve. And I think one suggestion which I will have for doctors in Pakistan is to have a database maintained of all doctors in Pakistan, where we can disseminate information with one click. obviously I think there are databases which are available to PMDC and so on, because within UK we are getting emails every week, every day. Things are changing constantly. New information is coming, and so it's highlighted the need of creating such a database where guidelines and other latest information from the world is being shared. The second question, obviously, is a point which is being made by Dr. Sara. She says the Yaran Watan website should also have a discussion platform where overseas doctors can actually give suggestions, which can be directly communicated with authorities.
Okay.
Let's have few more, and then I will respond in one go, and then I'll leave.
We got one more question, Dr. Hafiz, to ask.
Dr. Sohail Chugtai wanted to ask.
Dr. Sohail Chugtai, would you please go ahead?
I really appreciate the comment made by Dr. Zafar Mirza on telemedicine. We have been working abroad and not only gathered experience in telemedicine field, but we have snowballed to gather a lot of expertise around the world. I mean, I've developed a whole medical board for telehealth in the last 15 years, and I want to bring it to Pakistan. I've just shown a small glimpse of setting up a telemedicine helpline on the governor's request in 24 hours. This is the least we can do. But if we can be properly drained into the country, given a channel to operate, I think Yaran Watan is one of them, but it would require your personal input to have a digital health department. A digital health department is something we can now really come and assist the country with the best possible experience. Not only ours, we have developed a huge company around us. And I would really request Dr. Mirza to consider this option, having a digital health division of Health Services of Pakistan. That's my only humble suggestion.
Thank you, Dr. Sohail Chugtai. Can I just please add one more question here for Dr. Zafar Mirza? I have a question from Ahmed Nukhez. He's based in Oslo, in Norway. The question is about the government's policy regarding to the registration of medical professionals at PMDC, foreign graduates and specialists from Europe. I think a lot of us who are qualified abroad are having some difficulty. Would you please kindly help us with that? Would you like to answer these questions first, and then before we go further? Thank you.
Okay. Okay. I will respond to them, and then I'll make a comment, and then I will beg leave. First of all, database of all doctors. Brilliant idea. No-brainer. I think we should do that. There is no big. There should not be big discussion about it, so that everybody can be accessed. How we should do this is a question that we need to resolve. But I take note of this. Secondly, a pocket created in Yaran Watan for discussion platform is also a good idea. And not only discussion platform, but through also which we can actually hold sessions like these that we are having right now on specific issues, where I, as a minister, and I have now formed a very active committee of all health ministers, provincial health ministers also. So from time to time, depending upon various issues, we can hold these kind of virtual meetings as well. So taken. Digital establishment of digital health division is a brilliant idea. And I think that actually sooner or later we have to do this. As I said in my comments, that the time for telehealth, digital health has arrived. And Usman can tell you later that my passion is establishing a strong primary healthcare in Pakistan. And primary healthcare, which is based upon electronic records and which is based upon a functional referral system, which is not possible unless the whole thing is digitized, and the records are available at all levels of the healthcare. So that's my dream, if you ask me, that I want to establish. And we were working very actively on creating a model healthcare system in Islamabad. And we were quite ahead with it, but then the word changed because of COVID-19. But as soon as we are stabilized, I want to get back to that. And I think that with now so much heightened attention to telehealth and digital health, e-health, we should leverage all the expertise and resources and interests that we have. And for us as government, it is important that we create an institutional base through which all such contributions can be leveraged and harnessed. And other thing which I had started in before COVID was restructuring of my Ministry of Health, because Ministry of Health itself had to be reformed to come into 21st century and become a modern, agile organization fit for the purpose and agile and to the challenges of the contemporary world. So I was also in that process, and health information it was one new area that we had established in this, but we can actually think more carefully about it now that we get back to the drawing board about restructuring of the Ministry of Health, that how digital health can be accommodated as a visible one, section or division or directorate. Foreign graduates, PMDC, sore point. We have been through a lot of difficult time with PMDC. Intention was always to reform it and to make it efficient and very, very, again, smart organization, which does not allow any kind of confluence or any kind of unethical practices which were so much going on there. So we tried that, it didn't work. We are currently, our effort is to actually restart the operations. New ad hoc council has been formed. So it's just a matter of time, to be honest. I am the first person to see active and smart PMDC working and making decisions which are common sense based rather than just irrational decisions because we have established a certain kinds of statutory frameworks. So foreign graduates who are from credible universities, there should be absolutely no problem. We should be welcoming them and facilitating them rather than creating any kind of hassles. So it's just a question of time. It will be reformed and it will be taking care of all the, not only this, but all other issues that we have. Let me make a last comment. Yaran Watan is a government response to the passion that we see among all of you diaspora health community. As I said earlier, its success and failure depends upon you. But what we can assure you as government is that we would guarantee that all those who register here, all those who want to make any kind of contributions, you are facilitated. That's our only aim here. You feel facilitated. You feel that it was effective matchmaking that we help you with, and not only facilitated, but also we want to recognize officially the spirit and the contributions that you are making. If once it starts going, I have other ideas that we should be at one point starting the most important contributions to be celebrated, maybe doing an annual conference under Yaran Watan of all diaspora, inviting them here, bringing Prime Minister, and really raising the level of this initiative to a one which we all feel good about. I have seen examples when doctors have come to Pakistan to do service and have left very disgusted and very disappointed. And that, from that kind of also context, I draw this commitment that the government should be more active, more proactive, to support you, to support us. That's the whole idea of it. We want to facilitate, we want to recognize your efforts, and we want to guarantee you that your efforts will not go in vain. And we also want to celebrate you and recognize you as governments. That's what the whole VN is about. I really thank you very much, all of you, for giving me this opportunity this evening. Please continue with your work, great work that you're doing. And I really look forward to a very, very active and, spilling Yaran Watan, which really live up to its dream. Thank you very much.
Thank you very much, Dr. Mirza. On these conclusive remarks, I would just like to make one last remark with regards to what we've learned from this COVID-19 is perhaps we could include our in our syllabuses in the medical education in Pakistan, how to deal with these things in the future. I would also like to thank you, and I'm sure after this very fruitful meeting, you will pass our feelings, our emotions, and our sincerity to the policy making and decision making in Pakistan. I would like to thank you, all the panelists. I would like to especially thank you, Dr. Irfan Rashid,